The current set of circumstances is the result of policy decisions and a particular way of doing things that it's not served us well, that there's huge negative spend as a result of those policies, and that I think we're overdue to have another look at how we construct social policy based on wellbeing, and I've proposed a sort of social investment and public health model as the pathway to explore. So the demographic profile of New Zealand is undergoing radical change in that as the baby boomer generation reach old age, we're creating a bubble. Normally that has been the smaller section of our population. It's no longer going to be that. Birth rate's gone down, so there are less children. And in fact, as we move forward, the number of people in the income earning, tax paying bracket is going to reduce. So we can't afford to squander the potential that is there in children. So if you've got 27% of children being raised in poverty, compromised to varying degrees by that, that's something we can't afford going, because we need all of them to be actively participating, not just as taxpayers, but in the workforce that will be needed to support a generation that will have higher needs because of their age. And we have a comprehensive universal payment system that will need to be paid for. So I think that's our greatest challenge, and it's also the most compelling argument, possibly, because it's kind of hard data, that we have to do this differently. We can't afford what we're doing now. There are some valuable lessons to be learned from the Scandinavian countries, because they are the ones who I think epitomise that social investment model. I think we would have to modify it. It's based on high taxation, and so that's part of their culture, it's part of how people think. That would be a pretty radical shift for New Zealand, but I think it's not all about taxation of income, and that's what people tend to see it as. I think we need to be looking at some of the way in which corporate structures pay tax, some of the loopholes that we know exist that mean that some of our very wealthy people are able to evade their social contribution. I think we need to do a lot of work in New Zealand to reframe the government take as a social contribution. And so that's what allows us to have good quality education, good quality health. We all benefit from that. And I think while we can learn those lessons from Scandinavia, we'd have to tailor that to bring people on board with what that might look like in a New Zealand environment.